not, what you would need to hear from your public health experts to decide to go ahead and do that.
Yeah, thank you. And I think I'm going to let your listeners hear this discussion that we have daily and sometimes multiple times a day with public health experts whose job it is to clearly lay out what the science is and where we're at. We've said all along that the virus and the point that it's at in its transmission would dictate to some of the moves that we make. Interestingly enough, these were questions that I asked Dr. Burks about, and we've been seeing this happening for a while. Maybe Chris can be a little more eloquent about this, that while public settings that are more predictable, we still see spread there, but not as much, that there's been maybe a false sense of confidence amongst these social gatherings or extended family gatherings that have sped this up. So at this point in time, we continue to have these conversations. I think right now, some of the things that we have in place just simply need to be adhered to, like the mask mandate and the social distancing amongst family members. I'm not certain at this point, and we're still discussing it, if we're not seeing, again, I don't want to speak out of turn, I'll let the health experts correct me if I'm wrong. We're not seeing the massive spread in retail settings, so it doesn't necessarily look like there would be a need there. But the fact is that it springs up very differently. We're tracking schools very closely, obviously. But I think as we stand today, it's just a matter of using the tools that we have in place and actually getting adherence up. Again, the numbers we see, if we can get a 95% social distancing and mask compliance, it's dramatic of what will happen. So Chris, I don't know if I'll segue to you and correct any of that was incorrect. But at this point in time, we certainly always have to be watching. If this turns bad quickly and we're seeing things that we could do to slow it, we will implement those.
Yep, Governor, the thing that I'll just add is that I think, we're providing data, the commissioner provides data to the governor on a daily basis and lets him know where we're at with things. And certainly we are in a very concerning place. But I think a key point that the governor made is that we have tools in our toolbox that we have not fully utilized. And so while certainly as we, look to the future and are concerned, we would like to at least have been able to say, we gave it everything we had with the tools that we have, and now it's time we have to do something else. But I think it's important that as Minnesotans, we fully utilize the tools that we have that are so much less painful than other options that may need to be discussed.
And Chris, just a related follow-up, the governor mentioned getting to 95% mask compliance. Do you have any data on what mask compliance looks like right now?
I don't, Catherine. We're in the process of doing what we refer to as a case control study that allows us to compare cases with individuals who have not had COVID. We collect data on our cases, but without being able to do a comparison, we cannot speak confidently. So no, I don't have that kind of data.
Chris, this is Commissioner Malcolm. Just to jump in quick on that point, we have seen some other data from other surveys that suggests that Minnesota's mask wearing is slightly less than the national average and then some states, which is part of what leads us to think that we've got room to go here to increase these behaviors in a way that would be still very helpful.
Okay, thank you.
Next is from Tom Hauser of KSTP TV. Your line is now open.
Thank you. Good to talk to you, Governor and Commissioner and Chris. Governor, I'm hearing reports that in mid-November, you are preparing to close schools, possibly some businesses. Sounds like you just said retail is not a big problem, but perhaps bars and restaurants in mid-November if cases stay at the same trajectory, and that would include ending fall and winter sports, or at least for the time being. Can you respond to that?
None of that is correct, and none of those things have been discussed. Our toolbox is always available, but I can assure you that the commissioner and the director are on here and anyone else, there have been no discussions with that specificity. And we've got a school opening plan that is working. The dials are being turned. So that's not true.
It seemed as if everything we heard from Director Erzman and Commissioner Malcolm were talking about we may need to, and yourself, we may need to take additional steps. If it's not closing things down further or reclosing things, what additional steps are there other than the adherence to the current guidelines that you have?
Yeah, it's that, the adherence to the current guidelines. Don't gather in large gatherings. Don't go to super spreader events. Don't go into businesses without masks on. Don't gather with Aunt Mary and Uncle Larry for something if you don't know where everybody's been. I think Chris's point on this is, and Jan's point is, we have room to grow here. I'm pretty disappointed with, and again, there's some studies that are out there and we can do some more, but it appears like there's pretty good reason to believe that we're wearing masks less than the national average. I usually expect Minnesotans to be above average, if you will, in everything. And so at this point in time, we are still asking for compliance to the things we know that work. Because they're more effective, their mask wearing is free, and it allows our businesses to stay open, because we've seen this time and time again, states that decided to not do these things ended up closing business anyway. So we're still of the belief that if people buckle down, dig deep here, do these things, that there's good data to show we can slow the spread.
Okay, thank you, Governor.
Next, we have Steve Karnowski of Associated Press. Your line is now open.
Yeah, thank you, Governor and Commissioner, for taking my call. As we're speaking here, Vice President Pence is speaking in Hibbing, and MDH figures show that there have been a number of outbreaks associated with past Trump-Pence campaign events. Do you have any concerns about this one here? Have you done anything specific to make your concerns known to the Trump campaign about this? And can you say anything about any agreement that the Trump campaign might have with local authorities that are concerning the spread?
Yeah, and we've made our concerns known to all political campaigns. America's right to elect their leaders democratically is sacred. We want to make sure people are able to participate in those things. But we've asked campaigns to adhere to CDC guidance and to Minnesota Department of Health guidance. These large rallies that are unmasked and elected officials going to, I just have to be candid, they're incredibly unhelpful. If you're coming to Minnesota to seek votes, bring us testing today, bring us PPE, bring us a partnership to get a handle on this. So yes, I'm concerned. We've reached out, we've received assurances again that the rules will be followed, but I think many of you saw, it started, I believe, as a New York Times or Washington Post story that those simply were not adhered to. So I'm asking once again, in fact, pleading with all campaigns, if you feel that solid about your candidate, go vote for him. If you need to hear him speak, just Google it and watch a speech on your phone, and let's get through this thing. So we're getting assurances that there will not be more than 250. They will be socially distanced. They will wear masks. I certainly would hope that's the case, not because we don't want to see a lot of people be enthusiastic about their candidates, but we know that if you do these things, infection rates will go up. And again, coming to an area that is seeing a pretty high positivity spread, it's just not the best decision.
Next, we have Theo Keith of Fox 9. Your line is now open.
Governor and Commissioner Malcolm, I'm wondering, given the spike in cases, are you concerned that we're going to reach a point pretty soon where all schools are going to be virtual only? And as a follow-up to that, somewhat related, high school athletes, are you seeing high transmission rates among them, or is it fairly low now that they're back to practicing and playing?
I'll let the second question go to my health experts, and I would say once again, to be very clear, our goal is to get students back in school, keep them and the educators around them safe and their families safe. Cases spiking is an indication, as you'll see, of community spread. And again, we will make appropriate changes with our local partners, with what the data shows and with what mitigation can do as it happens. But I think all of your listeners on here, a similarly sized population state without quite as large an urban area in our neighbors in Wisconsin, we're talking about high spike here of 2,200 cases. They were reporting 6,000 cases. Hospitals overflowing and temporary beds being set up at the fairgrounds. That is the crystal ball of our future. We are not fortune tellers here. It's scientists and it's numbers. And this issue of what will happen and what will happen, with sports and things like that, I think people need to wrap their mind around how bad this got in some places and how bad it is getting. And all of those things will end up happening if we don't make some of these changes. So I'll let you guys speak to the specifics of high school athletes, but certainly, as a high school coach and someone who's deeply engaged with educating the whole child, I know how important they are, but I also know how risky it is. So I'll turn it over, Jan or Chris.
Yeah, thanks, Governor. Chris, I'm going to ask if you can update on some of the specific breakdowns of schools and athletics was the specific question, but I just want to make the general overall point, and I think your question does this, Theo, is that when you have this degree of community spread, it just gets harder and harder to keep the infection out of these important settings that we're trying so hard to protect, whether that be schools or long-term care. It's just the image and the analogy we're using lately is you can build a really high set of floodgates, but if the wave is of a certain height, the highest floodgate's not going to keep it out, and that is a worry for these critical settings like schools. But the schools are working so hard and really doing a phenomenal job of trying to really manage case growth within their settings. Athletics, it's the sports, the games themselves, but it's also all the other ancillary activities that go along with it, the social gatherings that tend to accompany the games. But Chris, can you share a little more data?
Sure. So just looking at our sports-related cases overall, we have had 3,410 cases associated with sports, and focusing on the high school athlete age, 593 cases. If you take that down to the middle school, we add 309 cases. And if we just to put it in context with that 3,410 cases, that included over 7,000 household contacts who needed to be isolated. And if we look just in the last week, we have added 2 confirmed outbreaks in high school, 1 in volleyball, 1 in soccer, and we have 8 suspected outbreaks that we're looking into, 1 in elementary age dance, 4 in high school, 2 volleyball, 1 dance, 1 hockey, 1 at a college and university level, and then 2 adult club sports. So we're continuing to see evidence of transmission related to sports.
Okay, thank you.
Next, we have Heidi Riddle from Care 11. Your line is now open.
Hello, I know we're a month out from Thanksgiving and families are making their holiday plans right now. What would you say to families, especially now hearing what we know about it also spreading in smaller social gatherings as well?
Jan, I'll leave that to your expertise.
Okay, Governor, thank you. Well, I think the governor mentioned that Dr. Birx talked specifically about upcoming holidays and her fear from a national perspective, but certainly we wouldn't be immune to it here in Minnesota, that this is really ripe for the Thanksgiving holidays are really ripe for for fueling further spread as people are traveling, from around the country, especially from, neighboring states here in Minnesota, bringing the virus with them potentially, and just the very nature of, large family gatherings, multi-generational gatherings, and the sadness of it is we're all even more eager than usual this year to gather with families. But one thing we'd say is our guidance has been to limit gatherings to 10 or less people for a long time, but there's nothing magic about 10. So I think our guidance would be to really be very, very careful with those gatherings and to really think twice about gathering with people outside of your immediate household. Chris, would you add anything?
No, I absolutely agree with that. I think that, as I mentioned earlier, fewer people is less risk, but it's not no risk. And given the high level of transmission in our community, I think we have to be really careful. And I think we can say with confidence that the large extended families coming together, bringing multiple families from, around the region, and all the cousins getting together with the aunts and uncles, that absolutely would be a really, really bad idea this year. And even a more limited gathering needs to be thought through very carefully.
What would you also say about, I know some people have talked about, potentially getting tested before Thanksgiving, and do you think that gives people a false sense of security, or what would you say to those people?
I think the challenge that we face with the testing is that it's only for that day. So if someone gets tested and they can then isolate for 14 days after that, I think it's meaningful. But if you get tested on Friday with the thought that on Monday you're going to travel to see family, it would give you a false sense of security.
Thank you.
Next, we have Mohammed Kali of Kali Radio 101.7. Your line is now open.
Oh, thank you, the Governor, and thank you, Commissioner, for dating with us database. We got here Hennepin County and Ramsey County and Dakota County is higher. Did you have, why do they have more cases than any other county? And also, do we have a more plan for large East African Reef, large East African Reef in this three counties? What plan do we have, and what kind of work we can help?
Jan, I'll let you or Chris talk about the specifics, obviously from a population density and the easier spread, but I do think, Mom, your question is well put, and we're obviously from the beginning understood that the disparities in COVID-19 were hitting communities of color, especially Black and immigrant communities, harder. One of the things around that was trying to bring down barriers to testing, bring them closer to the population, make it easier for folks, and then doing testing through trusted community partners, where folks felt like they trusted the people who were testing, they trusted the location, and they were not afraid to go in. But anything to add to that, Commissioner or Chris?
No, I think, Governor, you hit the high points really well. Those larger population centers just obviously are going to be the source of a lot of growth, but just to reinforce that this is now obviously a statewide problem. And Mohammed, as we've talked on some prior calls, it's so important that we do partner with community organizations, as the Governor's just said. And we're doing a lot of very specific partnering with culturally based media organizations and trusted community leaders, as the Governor has said.
Just to follow up, we do have a lot of Somali doctors and nurses. Why they don't come to the front line to help them be able to speak their language and culture so they can educate more than anyone else?
Mohammed, this is Chris Ersman, and I'll just mention that we have a number of Somali staff who are part of our teams that are doing the case investigations and contact tracing so that people can speak to someone in their own language. And we also have staff who are doing outreach and have speak Somali and have a number of materials that are available in many languages. So we just want to make sure that we can connect with you after to make sure that you have access to all those resources.
I just want to thank you. Right now, those 3 days, briefing Monday, Wednesday, and Friday, did help a lot to update the community also, just to update you that. Thank you.
Next, we have Chris Berg of Valley News Live. Your line is now open.
Governor and team, thanks so much for doing this call. You guys had mentioned that you're seeing a real uptick in cases and hospitalizations in greater Minnesota. I'm curious as to, one, why, what's going on there, and two, you alluded to some of the neighboring states being part of the challenge. Have you guys considered closing down the borders or stopping transportation in between the states like South Dakota, North Dakota, and Minnesota?
I'll take the final one if I'll turn it back to our team on the first one, Chris. No, and I want to be clear on this too, is that we're partners in this and that our folks go back and forth. For example, North Dakota has been testing a lot of Minnesotans and vice versa. And we know that folks go back and forth. And I just want to be clear, this isn't about casting blame. It's just that different decisions were made. And I think when the story of COVID is written and the facts that are out there, there were certain decisions were made. And certainly not every one we made have been correct. But I do think some of those basic things on the slowing of transmission, like mask mandates and those, have made somewhat of a difference. But no, we are one nation. We are not the Articles of Confederation. These are our neighbors. They are Americans. They're our relatives, my mom. And, so no, but we really do need, and I keep stressing this, we really do need, at a minimum, a regional strategy, and I think ideally a national strategy. I'll turn it back to you guys on the rural issue on the hospitals.
Yeah, I think as we've said a couple of times, what's causing the spread are just many, many, many different types of transmission events. Social gatherings, parties, celebrations, ceremonies, just gathering with friends and family without really taking those public health precautions is what's happening just all over the state. Chris, anything more to add?
No, I think that, yeah, wherever we're seeing, lack of masking, social distancing, gathering in large groups, we see transmission. And I think that we're seeing that across the state now.
Governor, actually kind of two quick follow-ups, if you will. So any thoughts on maybe like a quarantine procedure if you've got people coming in from South Dakota and or North Dakota, or even Wisconsin, they've got a high positivity rate? And lastly, sir, as we're doing this, I've been watching the Pence event. There is no social distancing, a lot of people without masks and hitting. Any punitive measures you're going to take against the campaign or the leaders in hitting?
Well, no. And I'm just disappointed to hear that, Chris. Thank you I haven't seen the update yet. And I think too, unlike the quarantine measures, so much of this is just about the social compact. I think most of us know, and I know this is very frustrating to a lot of people, but you just have to have people buy in and adhere. We need to set the example. Again, we've asked people, if you're exposed to someone, I was 14-day quarantine. I had someone on my state patrol team tested positive, and I didn't get it, and I wasn't, I was in according to that close contact. So I isolated for 14 days. A lot of folks are making these sacrifices, and it just kind of takes people to individually do that. So no, and here's what I would say is that, again, I get it. People signed waivers to go to that said they wouldn't hold the campaign responsible, but your neighbors didn't sign any waivers. The people who have to work that event didn't sign any waivers. The state patrol who's making sure, because again, we want to make sure people are safe, want to make sure people participate in the things, especially in democracy. But at this point in time, listening to a speech in a crowded area does not constitute and worth the risk. So I'm just deeply disappointed. I guess we'll go back and talk about what we can do, but I take no pleasure in having to put some of these things in place, but we're using the best knowledge we can to help Minnesotans know that both they and their neighbors are adhering and keeping folks safe. So, Chris, anything else on that?
No, nothing to add. Thank you.
Thank you, guys. Appreciate that.
Next, we have Sloan Martin of WCCO Radio. Your line is now open.
Hi, this question is for Governor Walz. A lot of my questions were already taken, but I do want to make sure, I know it was asked previously about specific discussions that might be happening in terms of shutdowns, but I'm wondering if people should feel this sense of urgency. Like, could there be another shelter in place if things do not improve here? And I know there is a dial back dashboard, but is there a chance that we get to that point in the near future where that decision has to be seriously talked about?
Well, we said our toolbox has a lot of things in it. Just to be, quite candid, we knew that shelter in place could not last forever. That is a really big thing to do. We have a vast majority of our economic activity has returned. A lot of the things that quite honestly make life enjoyable have been able to be returned, although with some limitations around. So certainly that's a tough one. But this again, it's the lack of a national strategy. It's the lack. Again, I think rather than a shelter in place, a national mask mandate would probably have more of an impact. And so I certainly, and I do not discourage them. I'm going to let them speak. Our health team is always encouraged to speak as candidly as they possibly can on their guidance. But what they understand is there's also the considerations of what will people comply with, what is possible, what are the side effects or the implications of doing something like that. So I don't close the door, meaning that I think it's irresponsible not knowing what's going to happen with this virus, not seeing what happens with hospital capacity and all that. But that's not a long-term solution. The long-term solution is the one that we put into place. Manage this with personal behaviors, manage it with social distancing, the mask, manage it with some limitations on indoor dining, large group gatherings, those types of things. Those all make a difference. And I think your sense of urgency, if I could answer that one, yes. What I'm saying, Minnesota, is we have come to that day that we thought may be here. We all hoped it wouldn't, but we planned accordingly. But it is upon our doorstep now. If this starts to get really bad and we have to start reporting 5,000 or 6,000 infections and hospital capacity being maxed out, we still control our own destiny here. And I'm just saying that the data supports, and Chris is right, it doesn't remove all. You can wear your mask, you can social distance, you can do everything right, you get it. Getting COVID does not make you a bad person. That is not what's at stake here. It just simply reduces the threat. So we're still trying, and I guess this call today and the point where we're at is to really try and re-stress what you're seeing happening is that now we need to buckle down and get it right.
Governor, this is Teddy. We might have to wrap it up with that question. We're just coming up on the hour here.
Okay, any follow-up on that question, and then we'll wrap it?
No, I'm good. Thank you.
Well, again, thank you all, Minnesotans. Thanks for all you've done. The sacrifices you've been asked it's rare that a group of folks have been asked to do so much. COVID-19 turned our world upside down. It also highlighted some of the best that we have to offer of people coming together, help with community, trying to make sure that we're doing the things necessary to slow the spread of a new novel coronavirus that long-term implications are still at this time unknown. We've had a lot of success, but we, like everyone else, are susceptible to how quickly this can blow out of proportion. I think if we dig deep here for the next few weeks, we can start to potentially see a change for the positive. And I would ask all of us to try and do that so that both those that are most vulnerable and for those activities that we love so much that we continue doing in granted in an altered fashion, but better than the alternatives we've seen. So thank you for that. We'll continue to follow up and have a good day, everyone.
Ladies and gentlemen,
You were just watching Governor Walz and health officials discuss the latest COVID-19